Welcome to Start Local, where we talk with business owners, leaders of nonprofits, and other members of our community focused on doing business in and around Chester County, Pennsylvania. Each episode will provide insight into the local business scene and tell you about opportunities to connect with and support businesses and nonprofits in your local area.
The Southern Chester County Chamber of Commerce promotes trade, commerce, industry, and sustainable economic development while supporting a diverse and growing marketplace. The Chamber is proud to partner with the Start Local podcast to raise the profile of businesses and nonprofits throughout Chester County. Learn more about the Chamber at sccc.com. That's sccc.com.
I am Eric Goodwinson, and I'm here today with my co-host, Liam Dempsey. Liam, how are you today?
I am doing fantastic, Eric. Really excited for today's conversation.
Well, today's podcast studio is a little crowded, but I'm happy about that. We have two guests with us today, both from Penn Medicine, Chester County Hospital. First, I will introduce Dr. Karen Pinsky. Dr. Pinsky is the Chief Medical Officer at Penn Medicine, Chester County Hospital. Board certified in pediatrics, Dr. Pinsky maintains a clinical practice as well as performs her duties as CMO at Chester County Hospital. Hi, Dr. Pinsky.
Hi, it's a pleasure to be here. I'm looking forward to the conversation.
I am too, and I'm going to introduce our second guest. It's Dr. Pinsky's colleague, Ed Callahan. Ed is the Chief Human Resources Officer at Chester County Hospital. He works closely with Dr. Pinsky. Welcome, Ed. Thanks for being here today.
Thank you for having me.
Well, let's start big. Southern Chester County and Western Chester County are currently without traditionally convenient access to hospitals due to the closure of a number of such facilities in recent years. Would you please talk about Penn Medicine's efforts to support those underserved regions of our community? And specifically, how are you handling the influx of new patients in Chester County Hospital?
Sure, Eric. I'd be happy to answer that question. I can speak for Chester County Hospital as well as Penn Medicine to say that we really were dismayed when those hospitals closed. We consider all of the residents of Chester County as well as the surrounding regions to be our community and our patients. And so when those hospitals closed, it did put quite a burden on Chester County to absorb those patients. We feel very strongly that we want to develop more services and more offerings in those western and southern areas of the county. We had attempted to engage with the Veterans Administration and reopen some part of Brandywine Hospital, but as it turns out, after they did some geological and land surveys, that area really isn't suitable to be developed. So we're still looking for opportunities within that community as well as in Southern Chester County to evolve and develop more services. It might be in the form of more of a micro hospital or perhaps a more expanded multi-specialty site, maybe with an urgent care or a few temporary beds. We don't know what that's going to look like, but we do recognize that the community needs more service. In terms of absorbing the patients here at Chester County, we really did need to pivot. We had to pivot hard around COVID and then again around the hospital closures. And I think we've done a really nice job of changing how we engage patients here in the hospital and out in the community to try to be more inclusive and just address the needs more directly of our patients that are coming from further and further away in the county.
Speaking of meeting the needs of folks in the community, health inequity and social drivers of health are becoming a stronger focus, at the very least for the medical community and certainly others beyond that. But particularly in areas like Chester County, which has a significant population of migrant workers and those who live at or below the poverty line. How is Penn Medicine adapting its practices at Chester County Hospital in light of the greater appreciation for health-related social needs?
That's a great question. And I think if you speak to most of the physicians and the nurses who work here at Chester County, I think that's one of the things that attracted us to this facility is the recognition that we live in a very diverse county, and it's wonderful to see sort of a broad array of patients. Nobody really likes as a clinician to sort of see one type of patient and have everybody be the same. So I think we're really fortunate in that regard. I think we've done a lot to address the social drivers of health, but not nearly as much as we need to. We're starting with basic things like things such as just collecting the information, just asking the questions when patients present to us, either in the outpatient setting or in the hospital. Where are your pain points? What is keeping you from living a healthy and productive life? Is it transportation? Is it access to food? Is it social supports? So that's the one thing that was easy for us to do, which is just start asking the question. And then now we've got an obligation. Once we're asking the question, what services do we have available through our social work department, our case management department, other types of Penn medicine at home healthcare to actually reach out and address the needs of the patients and our employees so that they can actually fulfill their promise and lead healthy lives.
I know I'm biased with a career in technology, but we do enjoy talking about technology on the show. So listening to your answer there, and I'm thinking about how can we stretch resources? How can we stretch the labor that you have? How can we deliver services in better ways? I'm curious how you're working with AI and the latest new technologies. Can you share how you're using AI at our local hospital and how you might be looking to implement AI in the future?
Absolutely. It's actually a really exciting field, and Chester County is dabbling in it, but all of Penn medicine across the board, much research is happening as well as experimentation and pilot projects. Here at Chester County, we're using a couple of opportunities to leverage artificial intelligence or machine learning. One of them is just in algorithms that help identify patients who are a little bit sicker, who are a little bit more at risk to decompensate. That's something that we've been working on for many years, identifying patients who might be developing sepsis or might be developing particular conditions that we need to intercede on. Another place that's actually quite well developed is using artificial intelligence in interpretation of images. If you speak to any radiologist, they will tell you that their workflow, that their burden, the number of images that they have to read has just increased exponentially. We're just doing more tests because our tests have become more effective, more helpful to diagnosing patients. And so the number of images they have to read is skyrocketing. And because of that, they need the assistance of technologies such as AI or machine learning to help them ascertain which patients' images need to be looked at more particularly by a clinician, a set of human eyes, and which look 100% normal. I'm going to give you just a really nice example. We're starting to think about, are there ways, for example, for EKGs to just say, this one is stone cold normal and have the machine determine that that's the case, and have the physicians who have expertise focus on the ones that are a little bit off to do that fine-tuned, nuanced interpretation. So those are just some areas that we're looking at.
That's really interesting because I expect that lightens the burden for your clinicians, your medical professionals. There's plenty of people with medical issues that if they can let those who are says the non-doctor, fully healthy with respect to this condition, that might lighten their workload. And I want to dig into that. And this might be an Ed question. So Ed, we've been hearing generally about a lot of burnout across the medical community in recent years, due in no small part to the pandemic. But we're wondering, how is Penn Medicine supporting staff across all your departments? We know you've got a lot of different departments, some medical, some not. How are you working to support them to reduce burnout and to improve staff retention?
Yeah, thank you for the question. Here at Chester County, we have a couple of specific programs, one being the We Care program, which is a program in which our staff can secure chat the We Care team and get a peer to respond to talk through the emotional support that they may need. And then that individual who's been trained can help make referrals to other services for more long-term support that the individual may need. So anyone at Chester County Hospital has access to that and can reach out to the We Care team. So that team, as I mentioned, does referral services, and those referrals are to supports that are available to all Penn Medicine employees, some of which include our employee assistance program. So connecting with live clinicians to either have virtual visits or in-office visits. We also have programs that are available to all employees to deal with things outside of the workplace. One of them that's very popular and particularly, I think, is useful for healthcare providers is a program called Wealthy. And that allows individuals to reach out and get help with what you would consider case management for either yourself or individuals living in your home, be it a aging parent or a child. We have found, as a healthcare professional, you're giving of yourself all day. So to have to go home and then think about how to do that for the loved ones around you, that can attribute to a lot of the burnout that our healthcare providers experience. So having programs like Wealthy, having resources like EAP and other virtual platforms that employees are able to easily connect to, and then also programs like the We Care program where you can reach out to a peer and almost in real time have that connection. That's really trying to meet everyone where they're at, depending on the need that they have in that moment.
That sounds like a key focus of a lot of workplace initiatives of very healthy organizations these days. So that's exciting to hear. More specifically, though, Ed, I wanted to ask you, what do you think is the hardest part of recruiting and retaining doctors and nurses these days?
I think, Liam mentioned it, alluded to it. It really is that COVID had people look at life in a very different way, through a very different lens. And so we have seen people make career changes, and there is a lot of competition in all industries. And so with that, you're trying to always find people, both here locally, but also look beyond the local market for talent because people are moving. People are changing jobs. People are thinking through, what they're going to do next. So our biggest challenges really are trying to make sure that when we bring someone into the organization, that we have them stay for a long period of time. And so we do that in a variety of ways, making sure that we're talking to employees about why they're staying. Our long tenured employees have some of the best advice on why they continue to stay here. And so we garner a lot of ideas from those individuals through what we would call stay interviews. Gone are the days where exit interviews are the norm because you're asking an employee when they're ready to leave an organization what we could have changed to help retain them. But really listening to our employees and trying to understand those who are staying with us for long periods of time, for tenure beyond what we would normally see in the industry, is where we try to focus our efforts, and then replicating those experiences so that we can retain staff.
Dr. Pinsky, as a medical professional, what do you think of Ed's answer? Are we on track? Is there anything you would add to it?
I think Ed's spot on. There's no doubt that caring for patients well in this day and age means that you've got to give of yourself. And sometimes that giving of yourself to your patients, absorbing and being empathetic to their pain or their suffering, their distress, their family's distress, that takes a lot out of you. And I think increasingly, maybe because of COVID, maybe because of societal changes largely, there's a little less tolerance amongst both our employees and our patients sometimes for what those interactions look like. So it takes an emotional toll. It's satisfying, it's gratifying. I don't think you're going to find too many healthcare providers who won't say, and nurses and ancillary staff who won't say this is a very gratifying profession. It's a very gratifying experience to take care of patients, but it's also draining. It's emotionally draining. And I think we're really starting to address that the depth of how that impacts our physicians in particular, our nurses in particular.
So speaking of hiring, I expect that given the size of at least the hospital staff and the like, that you are always hiring. But what is the best way for folks who might be interested in a career with you where should they go to find out more? Where can they find opportunities of what's available, what you're looking for?
So the best way is to reach us through our careers page, and that website is pennmedicine.org/careers. You can search positions by zip code, by job title, and once you apply for a position, a recruiter reaches out, talk through what you're interested in, and then hopefully move on to meeting with a hiring manager. But really, that's the first step, is getting to the careers page, seeing what's out there, and seeing what might be a good fit for you if you're interested in joining Chester County Hospital.
And how do you work with local educational institutions to help create the labor force that you will need tomorrow? I've been impressed at hearing stories of some of the local high schools where they do things like they're actually exposing the students who think they're interested to, blood. And suddenly like, whoa, no, I have no desire to be a medical professional whatsoever. Or maybe they want to go into a different type of medicine that doesn't involve them coming into such close contact with bodily fluids. But how do you work with local educational institutions on creating that labor force and the workforce of tomorrow?
So we've always had partnerships with nursing schools, other schools that are providing education for some of the ancillary services like radiology, pharmacy, those sorts of things. But more recently, what we've been looking to do is look for some non-traditional routes for the labor force. An example is through Technical College, High School, Brandywine campus. We're meeting with them actually this Friday to talk about potential co-op opportunities for some areas like culinary arts, like building trades, like public safety, to really try to find those individuals who may not have thought that a hospital had a career for them, and to bring them into the institution, let them see and learn from us, and then hopefully stay with us. So those are some of the non-traditional opportunities that we've been looking at more recently. In addition, outside of actual formal relationships with some of the schools, we're looking at untapped audiences. So an easy example is our volunteer programs. We have teen volunteers here from the local high schools as well as from some of the universities. And we're working with volunteer services and others to get in front of those individuals and let them know about the career opportunities that exist here, because often they're here for that immersive learning experience and then they're going on to school and maybe not thinking about returning here. So while they're a captive audience, we want to be sure to talk to them about what's available here for them as a career.
Yeah, I'm really liking what the focus on the skilled labor, the skilled trades focus that you're doing. We're hearing a lot of folks in all sorts of industries realizing the value and the need to make sure that they have professionals to meet those needs. So I'm loving hearing about that outreach. Thanks, Ed. I want to change our focus from what you folks are doing and talk more about patients for a moment. From a patient perspective, does finding the right doctors, the right nurses, the right medical care team, does that really make a difference to patient outcomes? It might make us happy, but does it make a medical difference? And if so, what qualities should we look for when seeking medical care? I think Dr. Pinsky, I'll probably ask you to start on that if you don't mind.
Sure, I'd be happy to. There's a wealth of data, published data, that recognizes a couple of things. First of all, I'm going to say this somewhat gratuitously, but women physicians tend to have better outcomes than men. Not in every case, but in many cases. So I would say, gravitating towards, gender-specific physicians. I'm not saying there aren't fabulous men who are physicians out there, but it is a well-published fact. I think more importantly, and perhaps maybe a little less glibly, I would say it's really important that your healthcare providers and the team around you can relate to you. And that sort of, though we've segued away from employment, really it speaks exactly to what Ed's been trying to do, and I think what we've all been trying to endeavor to do, which is develop a workforce that represents and looks and acts and comes from the community that we serve. And so there's also really great data to suggest that if a patient who is Black goes to see a physician or interacts with a nurse who is Black, they're likely to feel more comfortable, reveal more in terms of what their needs are and for their healthcare, and ultimately have a better experience. So the accountability and the responsibility is on us as providers of healthcare to make sure that we are engaging our community to make sure that our employees represent them. And so I would say that's important. Personality is important too. I think some patients want a physician who's going to just tell them the answers. They want a medical team that is just going to drive for them. And others really want to have a much more participatory experience. More and more, especially with our younger patients, they really want what's called shared decision making. They want to sit down, explore the options, and then make the decision really in conjunction with their healthcare team. I like that approach. Some of our older patients really aren't as comfortable with that approach. They're more traditional and they just want the doctor to give them the facts and tell them what to do. But I think the important part of all of this is you need to find a physician and a healthcare team that suits your own personality, your own needs, and ideally resembles you in some way.
That's a deep answer, and that it can really be understood and applied in a few different ways. And I want to go back to how Liam started it. He was asking about positive outcomes. And I wanted to go on that point and just ask about consistency as well as positive outcomes, because we all want positive outcomes, but we also want consistently positive outcomes. I know that's entirely too much to ask. And that doesn't come by accident. I'd like to know how you drive towards consistently positive outcomes in your organization. And we need to be candid about it. Despite everyone's best efforts, sometimes things in any industry can go wrong. How do you handle mistakes and learn from them when things do not go perfectly well, or at least not perfectly the way that you expected? And I'd like to hear from both of you.
Sure, I'll jump in, and then I'm really eager to hear Ed's perspective as well. But certainly the Chester County Hospital and Penn Medicine globally is focused on becoming what is called a highly reliable organization, or HRO. And the models out beyond healthcare are industries like the nuclear industry or the airline industry, where generally speaking, though they are complex and high risk, they have relatively few errors. And so in healthcare, we endeavor to be very consistent, very intentional about using standards, using evidence when we treat patients. And this is incredibly important. When there is a mistake, when there is something that doesn't go well, we need to be able to feel comfortable talking about it so we can learn from that mistake. We've known over the years that punishment and discipline around true human error does not actually achieve better outcomes, and in fact worsens outcomes because there isn't an opportunity to learn from the mistake. So we're really growing as an industry and recognizing that the more we talk about where we have failures or opportunities for failure, we want to catch them before we fail, but opportunities for failure, and we recognize those, the better off we're going to be.
Yeah, and just adding to what Dr. Pinsky shared, I think with the high reliability journey that we're on, from an employee perspective, trying to ensure psychological safety for employees is really important. And that starts with the relationship that they have with their manager. Of course, if that relationship is strong and one that the employee is comfortable with, they're more likely to come forward when a mistake is made or to bring up a concern that they have that could lead to a potential mistake. So ensuring that those relationships are developed early on and really built upon as the employee stays within that department or within the organization are important, and also making sure that we're looking at not just where we see employees speaking up, but where we don't see employees speaking up. I think when you think about psychological safety, it's as much about the incident that you may have in one area as it is about not having incidents in another, and really trying to figure out, is there psychological safety in that space? And if not, or if it's not as good as it could be, how do we help develop it or foster it in a different way? Because as Dr. Pinsky mentioned, I started my career as an EMT almost 20 years ago, and I can remember a number of times where I was afraid to speak up because you were afraid of reprimand, you were afraid of disciplinary action. And today, as an HR team here at Chester County, we're looking at not necessarily, what we thought the intention was if a mistake is made, but really what led to that mistake. Was it a process issue? Was it a systems issue? If most people aren't waking up in the morning coming to work with ill intent, of course. And so really looking at, did the process fail? Did the system fail? How do we fix that? And how do we ensure that that person feels emboldened to speak up next time if something comes about that they're not comfortable with or that they have concern about?
Ed's answer was far better than mine. Yeah, great. I like the way you put that.
I think they were both fantastic answers. I was quiet because I was listening. There's a lot shared there, and I love the focus on to simplify your answers, honesty to prevent future failure, and I can imagine what a challenge that must be to constantly foster, right? Secrecy likes the darkness, and we constantly have to try to encourage people to embrace the light. And I know almost nothing about your work culture. I'm not trying to paint you in a good light or in a bad light, but it's a lot of work to build what you're talking about. So thank you. As a patient of the hospital, I love what you're doing, your commitment to excellence. Thank you. How has telemedicine impacted Penn Medicine and the healthcare industry in general? It kind of exploded on the scene from a patient perspective during COVID. And I think there's been a lot of positive from where I sit, because in some ways it's much easier to get to a doctor or to a medical health professional. But I expect there have been some challenges as well. I wonder if you folks can talk us through that. What's the good and the challenging about it? How has it changed?
Sorry to speak over you. I think it has really improved access. And certainly patients who feel comfortable with the technology can make appointments more easily, don't have to worry about transportation. There's definitely some sort of, internet deserts and connectivity deserts. And so we do have populations that aren't as comfortable with technology, and that does pose a challenge. So I would say that's one of the downsides. But it has certainly improved access. I am a bit old-fashioned, and so I think that there are some specialties and disciplines that lend themselves more easily to a telemedicine encounter than others. The one thing I can say is Penn Medicine uses it fulsomely, particularly for employees, to avoid having employees seeking out healthcare or going to urgent care or emergency departments needlessly. And Ed, I don't know if you wanted to talk about that a little bit, how we have after hours availability for our employees to seek out telemedicine care.
Yeah, as Dr. Pinsky mentioned, Penn Medicine on Demand is a service available to our employees. They're able to connect with, make an appointment, connect with a clinician almost in real time and have those needs met. And also for telepsych services. So if an employee, back to some of what we mentioned earlier, is dealing with a behavioral health issue or something related to needing emotional support, they're able to connect with EAP providers via telemedicine as well. And so I think that's really important for our employees to help keep them going, of course, make sure that they're able to be their best so that they can care for our patients. So trying to make that access easier for them is something that we're always thinking about.
And in the hospital proper, we do use telemedicine for some of our subspecialty consultations as well. So it has expanded not just access outside the hospital, but even internally. It expands access if we need sort of a particular subspecialist, a genetic counselor who perhaps needs to meet with a family on the inpatient side, or a geneticist for our NICU patients, neurology consultation as well as psychiatry consultation. So rather than having a physician here who might not be leveraged to their fullest, we do have the ability to use telemedicine to provide these subspecialty services for those appropriate disciplines where you can have mostly a verbal interaction.
My primary care is with Penn Medicine, and during the pandemic lockdowns, I had no choice but to try telemedicine, and I was completely surprised by how well it worked and how smooth and easy it was to get the service and treatment that I needed. So it's fascinating to think about all the different innovations that are happening and probably are happening at a quicker pace because of all the pandemic lockdowns that were necessitated there. One of the other developments that we're seeing is that the days of independent community hospitals seem to be over, or at least coming to an end. Chester County Hospital has been part of Penn Medicine for some time. How does Penn Medicine differentiate itself from other expanding networks in our region, such as Mainline Health and Christiana Care?
I'll take the first part of the question, and then obviously interested to hear Ed's perspective as well. I would say we are very proud to be part of Penn Medicine, and being a part of Penn Medicine, and we've been a part of Penn Medicine for almost 11 years. It'll be 11 years in September. Has been just really an incredibly positive experience, I think, for the hospital, but also for the people in the community. I think Penn Medicine distinguishes itself in a couple of ways. It's a very progressive institution. I think the research base and the fact that we're constantly the beneficiaries of some of the translational work that's happening, where there's bench research that's literally getting applied to therapies that are being offered to patients in the community. We're about to embark on having our cancer center join the larger Penn Medicine Cancer Center. They've always been part of it, but we will, by making this change, which is really more of a logistical change, allow some of the clinical studies that are done in cancer patients, comparing one group of patients on one therapy to another group of patients on another therapy. We're going to be expanding the access of our oncology, our cancer patients, to some more clinical studies. So I think being part of Penn Medicine really has it's opened many, many doors and windows for us to bring sophisticated and very progressive therapy and studies to our patients in this community.
Yeah, and as we think about the opportunities for employees, I think one of the most interesting things for me is to see the number of employees who have the ability to move around based on changes in their career or their life circumstances. Myself, I started at Princeton Medical Center in Princeton, New Jersey, which is part of Penn Medicine, and then transferred here. But I've seen a lot of staff who were in Center City and at some of our downtown institutions. And as life changed and they looked for schools for children that they had, and they've grown, they've been able to move out into suburban areas like Chester County, like Princeton or Bucks County, and then take their career with Penn Medicine into those areas. And so I think when you look at Christiana, when you look at Mainline, from an employment perspective, that is one major benefit that we have over some of our competitors. In addition to the great culture, like Dr. Pinsky mentioned, the innovative research, the many of firsts in the medical history that has been made in the past and is continuing to be made now.
So I'm going to throw a tough question at you now, or I think it's going to be tough, particularly given the number of local businesses and nonprofit organizations that you and your colleagues at the hospital must work with on a regular basis. What is an area of business or nonprofit that more people should know about? I think I stumped them, Eric.
Might need to have the Jeopardy theme music. I don't know if we could get that licensed for this podcast, exactly. But could help.
We'll have to pose our answer in the form of a question. I'm not sure exactly. I do believe that. Sorry, I keep circling back to the themes we were already talking about, but I do believe that there are community-based organizations to help the members of our community, whether it's a food bank, transportation aid, grants, or opportunities to have programs and have people tap into those programs. I'm not sure that we have a great process right now to make sure that we're connecting people to those organizations. I can't tell you which organizations. I can just tell you, I know it's a resource-rich community with a lot of caring organizations, and I'm not sure we're connecting our population to those organizations as well as we should. Didn't really answer your question, but I'm sticking to it.
No, that's a fair answer. And I do see that you are doing more outreach to community organizations and to the community in general. And one of the ways that I've witnessed that is through the Chester County Community Foundation's Idea Council. Because you've both been active at organization to help amplify the message about all the positive things Penn Medicine is doing for the Chester County community. So we appreciate and thank you for that. I wanted to ask you about your enormous expansion of the Chester County Hospital building. Tell us what you were looking to accomplish. Did you meet that goal? And what's next?
Some of that is really easy to answer. Before we built our newest wing, which we called the pavilion, our operating rooms dated from the 1920s. So we opened the building during the very beginning of COVID. That was 2020. And the operating rooms we had been in were 100 years old. And it wasn't quite as bad as those old pictures you see with surgeons without masks and the big amphitheater, but it was close to that. And so we really needed modern, larger rooms in our operating space. And so our procedural platform is really enviably beautiful at this point. And most surgeons who walk through it are quite impressed. Just the equipment that one uses during surgery to do, for example, a knee replacement, it's just expanded. And so having bigger rooms and having better air circulation and some natural light so the patients don't feel like they're in a cave has really helped us in that regard. We also wanted bigger and more capacious rooms, and more places to put patients. Our intent had been to close down some of the older beds and keep some of our patients in the newer beds. And then COVID hit and we needed to use all of the beds. And then the hospitals in some of the areas around us closed. And of course, we have not yet closed many of the beds that we had intended to when we built the pavilion. So those are the two things I would mention.
Yeah, and I wasn't here during the expansion, but certainly I think, from my perspective in HR, it's always nice to have both the old and the new. There are certainly employees who appreciate the history of an institution like Chester County Hospital, but also love to see, as Dr. Pinsky mentioned, the new space in which they can work and deliver the care that they're coming to provide to our patients.
I will say, however, that now that we are bigger, it is not rare for me to hear generally an elderly couple walking down the hallway saying, "Oh my goodness, this place has gotten so big. It takes forever to get from point A to point B. It used to be a small hospital." And so there are some people that bemoan the fact that we've grown so much. And that's a good thing and a bad thing. We want to be everybody's hometown hospital and community hospital, but we also want to make sure that we can deliver the promise of more contemporary and progressive care. And so hard to know, but we do have patients who sometimes are not as happy with the expansion.
I bet those same patients, while being vocal about the change, are now thrilled they can avoid a drive to Philly and only have to navigate an unfamiliar elevator as opposed to unfamiliar roads, parking garages, traffic, and still receive top-notch care from the specialists that they need.
Mm-hmm.
Yeah. So here's going to be our last question. And as I've listened to you, Dr. Pinsky, and you, Ed, speak today, I've been impressed by a few things about your answers. Is one, you've really spent time thinking about this. You really work hard intellectually to achieve positive outcomes, a great working place, a great local community hospital. And from your tone of voice, and we have video going here, and I can see the concentration and the smiles on your faces were appropriate, that you're really passionate about what you're doing in your day job. So I want to ask you both the same question, but I'll ask you to answer it differently. And Ed, I'll ask you to go first because you've gone second on every time. So I'm going to ask you to go first this time. What's the best thing for you about working in healthcare? What about it inspires you to keep working? And as you've talked about, keep improving and keep giving of yourself.
I think for me, it's really about making that connection with people and watching people get better. And from my perspective in HR, as I said earlier, I started out as an EMT. I've been in healthcare all of my life. When I was a provider, it was about making sure that patients were taken care of and making sure that they got the care that they needed in the right setting at the right time, and then hearing about the outcomes that they had, because I was part of a small community where we knew everybody. And so that was meaningful to me. And as I've transitioned into an administrative role and in HR, it's really about helping other people do that. It's about seeing new nurses. It's about seeing, the person who's having a career change come in and realize they can make a difference in somebody's life. We're asked to care for people at really vulnerable times in their life, and that's a special thing. And to watch people step into that space and do it with empathy and do it with love and come out of it better for providing that care, that's what keeps me going.
And Dr. Pinsky?
I honestly cannot imagine doing anything else. I know there are some days that are hard, but waking up every morning, knowing that I get to come here to go to work. I know it sounds really Pollyanna-ish and somewhat ridiculous, but I honestly, it's just an honor. I feel really privileged to come here and know that everything that I'm doing is focused largely on making this place as good as it can be for the patients in our community. It's not easy work, and it's, I would say, getting increasingly more difficult for myriad reasons. But all you need is one patient to say thank you, or in my case, as a pediatrician, one child to look better tomorrow than they did today. And it makes all the difference in the world. So I truly, if I had it to do all over again, I can't imagine doing anything else.
Dr. Karen Pinsky, Chief Medical Officer, and Ed Callahan, Chief Human Resources Officer, both at Penn Medicine, Chester County Hospital. Thank you both for your time today. Really, really appreciate it. I'll ask you both to share where folks can learn more about you in your practice or hospital. And Dr. Pinsky, I'll start with you. Where's the best place to learn about your practice?
Well, right now I practice at the Chester County Hospital as a pediatric hospitalist. So I would say just going to our Penn Medicine Chester County website, and there's plenty of opportunity for them to learn everything they need to know about me and about this hospital.
Thank you very much, both of you, for your time today. We really appreciate you and all everything you do for the community, and of course all the answers you gave us today. Ed, how about you? Where can we find more information about you and what you do with the hospital?
As Dr. Pinsky mentioned, the best places for learn about HR and what we do here is pennmedicine.org/careers to learn about our opportunities and also what the HR team is doing both here at Chester County and at other hospital entities throughout the system.
And thanks to our listeners for tuning in today. We really appreciate your time and attention. We appreciate you being a big part of our Start Local community. As a reminder, we'll include show notes and links to everything we talked about over on our website at startlocal.co. That's startlocal.co. We publish a new episode every fortnight, and you can catch our show wherever you listen to your favorite podcasts. You can even tell your smart speaker to play the Start Local podcast. Thanks, everybody, for listening. That's it for us for now. Goodbye.